Namaste. Today I just want to highlight about difficulties or complications related to hernias. Hernia may be umbilical, inguinal, spigelian, any sort of. So the primary or first possible complication is irreducibility. Irreducibility is the content of the hernia doesn't go back into the abdominal cavity. That is called an irreducible hernia. So what would happen if the hernia gets irreducible is the vascularity will compromise. If it is intestine, the content of the bowel will not go across the loop of the bowel. So finally the patient will develop obstruction or sometimes strangulation. Strangulation is poor vascularity, and finally incarceration. Incarceration is gangrenous of that affected loop of intestine or maybe any other content, whatever is the content. Most of the times it is intestine or omentum. Few cases it could be urinary bladder, or sometimes cecum and appendix can also herniate. Very rarely tube and ovaries can also herniate if it is a groin hernia or maybe lower incisional hernia. These are very complex scenarios where the patient has to go through, and it would become an acute medical and surgical emergencies. And if the patient is a senior individual with comorbidities of diabetes, hypertension, or maybe heart-related issues, it may become that much challenging for the doctor who is handling, and invariably to the patient who is experiencing it. And it will be a very big financial burden to the family who will have to take care of that. So what I always suggest is, if you recognize any hernial situation, hernias anywhere in the body, please see your doctor and then get it fixed when it is comfortable with no issues. Thank you. Have a good day.